So students, now today we are starting and we will be completing the sympathetic system. In sympathetic system, we will be covering the adrenergic drugs and anti-adrenergic drugs, right? Both the things we'll be covering. Now, the major neurotransmitter of sympathetic system is adrenaline and noradrenaline, okay? So these are the two major neurotransmitters. Adrenaline is secreted from the adrenal medulla, while noradrenaline is basically secreted from all the postganglionic sympathetic cells, except, it is very important here, except sweat glands, which are innervated by cholinergic. So they have a cholinergic innervation. Okay. Then another neurotransmitter is there, dopamine, which is actually situated in the basal ganglia, limbic system, CTZ, and the anterior pituitary. Now let's see the synthesis, storage, and release and distribution of adrenaline and noradrenaline. Now here you will see that the first compound here is phenylalanine. So adrenaline and noradrenaline, all catecholamines are derived from the phenylalanine. It is converted to tyrosine, right, by the enzyme tyrosine hydroxylase, and this enzyme is rate limiting. Okay, this enzyme is inhibited by tyrosine, so this will inhibit the whole synthesis of catecholamine because it is a rate limiting enzyme. Then from tyrosine is synthesized dopa by the enzyme hydroxylase, right? This step occurs in liver, this occurs in the cytoplasm and adrenergic cells, or you can see the synaptic presynaptic fiber ke cytoplasm hai. Now dopa is then further converted into dopamine. Dopa is converted into dopamine. Okay, the enzyme which converts this is dopa decarboxylase, and this dopa decarboxylase is inhibited by carbidopa and benzerazide. Okay, now this dopamine then is transported inside the vesicle, and here it is converted into noradrenaline, right? The enzyme that is doing this is beta hydroxylase. And what are the inhibitors here? Now this beta hydroxylase is inhibited by disulfiram. Okay, and another thing, the vesicular uptake is inhibited by reserpine. Okay, tetrabenzene. So this, you have to remember, this vesicular uptake is inhibited by reserpine and tetrabenzene. Then the system moves forward and it is converted to adrenaline, and this conversion occurs in the adrenal medulla, right? And the enzyme that is acting here is N-methyl transferase. Okay, now this is the presynaptic terminal. यहाँ पे ये वेसिकल है, इसमें noradrenaline आया, यहाँ पे dopamine था, ये वेसिकल के अंदर आया, which is inhibited by this. Now this goes to the surface and then is released, है ना? Noradrenaline release हो गया. So this release is there, and then this is the postsynaptic terminal. Here this is the receptor on which the drug noradrenaline will come and attach. Then there are some receptors, so it comes here, then it goes there, and this is called as reuptake, right? So सबसे पहले तो अपन बात करते हैं ये exocytosis. Exocytosis is blocked by beryllium and guanethidine. Okay, and reuptake is blocked by cocaine and tricyclic antidepressants. Right, now after the release, then its metabolism is done by MAO and COMT enzymes, and then after metabolism it forms vanillyl mandelic acid, metanephrines, and DOMA, and they are all released in the urine. Okay, so this is how the whole phenylalanine, I'll repeat it once again. From phenylalanine is formed tyrosine by the enzyme tyrosine hydroxylase, which is inhibited by tyrosine. This tyrosine converted to dopa in cytoplasm and by the enzyme hydroxylase. Dopa is converted to dopamine by dopa decarboxylase, and it can be blocked by carbidopa and benzerazide. Dopamine then goes inside the vesicle and it forms noradrenaline. This vesicular uptake is blocked by reserpine and tetrabenzene. Then this noradrenaline is converted, and this is done by the enzyme beta hydroxylase, which is inhibited by disulfiram. Noradrenaline converted to adrenaline inside adrenal medulla by the enzyme N-methyl transferase. Then its release or exocytosis is inhibited by beryllium and guanethidine, and its reuptake is inhibited by cocaine and tricyclic antidepressants. It is metabolized by MAO and COMT inhibitors. So these are the this is the synthesis, storage, release, and distribution of the noradrenaline, of the catecholamines. Now let's see the receptors. Okay, so what are the receptors? They have alpha 1, alpha 2, alpha 3, right? Then they have beta 1, beta 2, beta 3. So these are the receptors. Let's see them one by one. Now alpha 2 की अगर अपन बात करें तो alpha 2 is of two types, alpha 1A and alpha 1B 1D. Alpha 1A is basically also called as uroselective, and it is present on prostatic urethra. There it reduces the urine outflow, okay, and it is present on eye, where it causes mydriasis. So it causes basically contraction of dilator pupillae, okay. Then alpha 1B 1D is present on blood vessels, and there it causes vasoconstriction and rise in the blood pressure, and all those things are done here. Then we have alpha 2, which is basically presynaptic. It is basically called as a brake system, or what you call as autoreceptor. So it reduces the sympathetic flow, okay. And then we have postsynaptic, which actually act on blood vessels and brain, okay. Then alpha 3, sorry, why have I written alpha 3? There's no alpha 3, sorry. We have beta 1. Beta 1 is present on heart and JG cells. Heart mein it causes increased rate of contraction, increased conductivity, and increased force of contraction, right? JG cells mein it causes release of renin and increases the blood pressure. Beta 2 is present on bronchus. It basically causes smooth muscle relaxation. So bronchus pe it will cause bronchodilation. Then uterus pe it will cause relaxation, okay. Bladder is there. GIT mein it will cause relaxation. Skeletal muscles pe it causes tremors, and blood vessels where it causes dilatation, okay. So these are the actions through the beta 2 receptor. Beta 3 is present on bladder, and here it basically reduces the urine outflow, and so we have a drug which is called as mirabegron, which is used in overactive bladder, increases the retention power of the bladder. It is also present on adipose tissues and on vessels, blood vessels present होता है. Then triglyceride को convert करता है free fatty acid में. This is their lipolytic activity, and then it also causes hyperglycemia. Why? Because it causes glycogenolysis, gluconeogenesis. This all action is mediated by beta 2 receptor. Here I also want to tell you a very important fact which I told earlier also, that sweating is controlled by or stimulated by sympathetic cholinergic receptors, okay. Now let us see the drugs which are acting through the alpha and beta receptors, okay. Now I'll explain it to you in a very simple flowchart manner. So we have directly acting drugs, then we have indirectly acting, and then we have mixed acting drugs also. So in mixed acting we have ephedrine, we have pseudoephedrine, right, and we have mephentermine. In indirectly acting we have reuptake inhibitors like cocaine and TCAs. Then we have drugs which cause displacement, that is amphetamines, methyl phenidate, and modafinil. Then in directly acting we have catecholamines, endogenous as in inside the body. What are they? We have dopamine, noradrenaline, and we have adrenaline, right? Then exogenous we have dopamine, which is given outside. Then we have dobutamine, phenoldiazepam, and we have isotretinoin, okay. Then non-catecholamines इसमें आते हैं non-catecholamines इसमें आते हैं xylometazoline, okay, clonidine, phenylephrine, then we have salbutamol, and we have methoxamine, right? So these are the drugs. This is the classification, alpha and beta mixed, that is directly as well as indirectly acting. Indirectly we have cocaine, TCAs, amphetamines, methylphenidate. Directly acting we have catecholamines and non-catecholamines, which are endogenous, exogenous. Okay, now एक एक करके let's see these medicines and what are the possible questions which are asked on these drugs. So that we'll take one by one. So the first drug that we'll take is adrenaline. Now adrenaline, it is the drug of choice in anaphylaxis, in anaphylactic shock, okay. Always remember this. कैसे देते हैं? इंट्रामस्कुलर 0.5 ml in 1:1000 solution, okay, on lateral thigh. If you have to give IV, then it has to be diluted to 1:1 lakh solution. Okay. The second use, adrenaline, used with local anesthetic to prolong the duration of action, but contraindicated in end arterial surgeries. This you have to remember, like ear, like penis, like finger lobe, and like any end organ where you are going to do the surgery. Then adrenaline is also used in patients with cardiac arrest. Okay, the preferred route here is IV followed by intraosseal and endotracheal. Okay, now coming to the next drug, that is dopamine. Now dopamine is a very very interesting drug because it is used, it's in different concentrations, it's got different effect. सबसे पहले तो this is the drug of choice in cardiogenic shock, okay, and oliguric renal failure. Now इसकी खूबसूरती देखो, लो डोजेस पे, कितनी डोज पे, ये क्वेश्चन पूछा जाता है, 1 to 2 माइक्रोग्राम पर kg पे. It is used, it acts on D1 receptors and it causes renal and mesenteric vasodilatation. So it increases the perfusion in renal and mesenteric vessels and keeps these organs patent. Then medium dose पे, which is 2 to 10 microgram per kg पे, it acts on beta 1 receptor which is on heart, so it increases the cardiac output. Okay, so heart को strengthen करेगा. And at high doses, that is more than 10 microgram per kg, it acts on alpha 1 and causes vasoconstriction. Right, so these are the three actions of dopamine. At different doses it acts at different levels, and that is why it is used in renal failure shock, cardiogenic shock. The next drug is dobutamine. Now dobutamine और dopamine में confusion होता है, लेकिन dobutamine basically it is a beta 1 selective agonist and its main action is to increase the functioning of the heart, increase the cardiac output. Okay, so this is the action by dobutamine, and that is why it is basically used in cardiac failure after a myocardial infarction. Okay, then next drug is dopexamine. It is a beta 2 and D1 agonist and it causes Na reuptake inhibition also. Okay, that is dopexamine. Then coming to some non-catecholamines. Now non-catecholamines, may we have alpha agonist, which is basically nasal decongestants, and these drugs are called as nafazolin, oxymetazoline, and xylometazoline. Now these drugs have a side effect of causing after congestion, and they also cause atrophic rhinitis. Okay, then there's another drug, phenylephrine. This phenylephrine is used as mydriatic, right? It does not cause cycloplegia. That is the differentiating feature from the anticholinergics. Then we have two drugs, methoxamine and mephentermine. Now these drugs, they are used basically in shock condition because they raise the blood pressure. Okay, there's one other, midodrine. It is a prodrug and they are used in treatment of orthostatic hypotension. Okay, after that there was a drug, phenylpropanolamine. This drug is now banned because it has a risk of hemorrhagic shock. Okay, now a very interesting drug which I think I missed there is cocaine. Cocaine, it inhibits the, we have studied that it inhibits the reuptake of noradrenaline, right? So cocaine basically inhibits the reuptake of noradrenaline. It also has local anesthetic properties. Okay, secondly, it is addictive, and a very interesting phenomenon which is normally asked also, cocaine causes tactile hallucinations, which is called as formication, a sensation of bugs crawling on the skin, and it also causes palatine perforation, right? Sometimes they will ask you cocaine causes this, cocaine causes this. So cocaine does not cause bradycardia. Remember this. Okay. Now coming to the next category, that is alpha 2 agonist. अल्फा 2 एगोनिस्ट यहाँ पे हमारे पास हैं क्लोनिडीन एंड मिथाइल डोपा. ठीक है, दे आर यूज्ड इन ट्रीटमेंट ऑफ हाइपरटेंशन. नॉन हाइपरटेंसिव यूजेस ऑफ क्लोनिडीन की अगर मैं बात करूँ तो यहाँ पे इसके बहुत सारे यूजेस होते हैं. सबसे पहले इट इज़ यूज्ड इन डायबिटिक डायरिया. ओके, सेकेंड यूज्ड इन माइग्रेन प्रोफाइलैक्सिस. थर्ड यूज्ड इन अल्कोहल, निकोटीन and opioid withdrawals. Fourth, used in epidural analgesia, epidural anesthesia and delivery. It is also used in ADHD. And sixth, it is used in Tourette syndrome. So these are the specific characteristics of clonidine. You have to remember all of them. They can be asked, and a lot of questions are asked on them also. Then another thing that sometimes with clonidine they can ask is that withdrawal of not withdrawal, I'll not say withdrawal, clonidine agar if not taken, like missing the dose and all, can result in hypertensive emergency. Okay, that is hypertensive emergency. अगर कोई दवाई मिस हो रही है तो कौन सी दवाई करती है? That is clonidine. Then other drugs, same as clonidine, we have its congener apraclonidine and brimonidine. Okay, so these drugs are there and they are used in glaucoma. Then we have drugs which is another very important drugs, dexmedetomidine, and this you will find in anesthesia. That is a very important part of anesthetic pharmacology. It is an alpha agonist and it is used as a pre-anesthetic medication, right? Then it is also used in sedation of already intubated and mechanically ventilated patients in ICU. Remember, dexmedetomidine, it is an anesthetic, pre-anesthetic medication. Okay. The next drug is lofexidine. This is an alpha 2 agonist and it is approved to reduce opioid withdrawal symptoms. Okay. Then there are other drugs. We had seen that guanethidine and guanabens, and what did they do? They are also alpha 2 agonist. They in fact inhibited the exocytosis of noradrenaline. Then there is another drug, that is tizanidine, which has been used as a muscle relaxant by its action on alpha 2 receptor. So that is these are the alpha drugs. Now coming to the drugs which are acting on beta receptor. So beta drugs. Now in this we have, तो सबसे पहले हम बात करते हैं beta 2 agonist, that is salbutamol, terbutaline and salmeterol and formoterol. Now these drugs are slow acting beta agonist and these drugs are called as LABA, or fast acting, long acting beta agonist. They are all given by the inhalational route in bronchial asthma, right? They have 3 side effects. First is tremors, tachycardia and hypokalemia. Okay, and due to hypokalemia they cause T wave inversion. So remember this beta 2 agonist drugs and their side effects. Then beta 2 agonist will never cause hypoglycemia. Remember this, because they are causing hyperglycemia by gluconeogenesis and glucogenolysis, right? So this is about the beta 2 agonist. Another drug is there, isoxsuprine and ritodrin. These drugs, they basically are used as uterine relaxants, as by beta 2 receptor they reduce the contractility of the uterus. Then we come to the indirectly acting symptomimetics. Now in this, a very important drug is there, that is tyramine. It causes release of noradrenaline from vesicles, right, of stored noradrenaline. So it is very specifically a specific drug in showing tachyphylaxis. This is the action of tyramine, and it also causes another important thing that is called as cheese reaction, especially in patients on MAO inhibitors. Okay, this is important. Then we have methylphenidate, atomoxetin, pamolin, and a new drug that is called as viloxazine, which are all used in ADHD, that is attention deficit hyperactive disorder. Okay, so this is indirectly acting symptomatics. If there are questions on treatment of ADHD where you have to write viloxazine, atomoxetine, any option coming out of this. Then इसी में आगे बढ़ते हैं, we have amphetamines. Now amphetamines have an addictive potential, so now they are not used. They produce tolerance also and dependence also. Okay, and since it is a basic drug, so any toxicity is corrected by urine acidification by ammonium chloride. Then there is a very important drug here, modafinil, and this modafinil is basically a drug of choice in narcolepsy, also in shift workers. It relieves fatigue in multiple sclerosis and in obstructive sleep apnea. Okay, then there is another drug which is called as solriamfetol. It is a new drug used or approved in excessive daytime sleepiness and narcolepsy. Okay, so these are some important drugs. Now we come to the एक इसमें रह गया क्या, that is mixed action symptomimetics. Now in mixed action symptomimetics, the drug that we have to discuss is ephedrine. Oh, I think by mistake in tyramine I have said tachyphylaxis. No, in ephedrine it causes tachyphylaxis. Tyramine में नहीं होता, tyramine में cheese reaction होता है. Ephedrine causes basically release of noradrenaline, and secondly it is a vasopressor. Ephedrine is vasopressor of choice in pregnancy. Okay, so remember this. Now we come to the sympatholytics. Okay, now in sympatholytics we'll be studying about what all? Alpha blockers and beta blockers. Okay, now alpha blockers are again divided into alpha 1, or I can say alpha blockers are divided into non-selective, and then non-selective is divided into reversible and non-reversible. Okay, now reversible we have phentolamine, and non-reversible or irreversible we have phenoxybenzamine. Okay, beta blockers are divided into non-selective, that is beta 1 plus beta 2, then beta 1 selective, and then we have mixed or dual action, that is alpha plus beta. So this is the classification of sympatholytics. Let's see them one by one. Now सबसे पहले irreversible वाला है phenoxybenzamine. It basically forms a very strong covalent bond, and thus it is an irreversible kind of thing. It is used to prevent hypertensive episodes in pheochromocytoma. Okay, it is also used preoperatively and during pheochromocytoma surgery also. इसके बहुत सारे uses होते हैं. It shifts the fluid from vascular to extravascular compartment. Then it shifts the like reduces the amount of catecholamines that is being released, and it also maintains a less blood volume in the system so that there is no severe hypertension on release of those extra catecholamines. Then the other drugs, phentolamine, they are used in the treatment of hypertensive crisis, in clonidine withdrawal, and in cheese reaction. Okay, phentolamine, another drug is tolazolene. So these are the drugs, these are the three indications in which these drugs are indicated. Now selective alpha 1 blockers. Selective alpha 1 blockers में हमारे पास आते हैं prazosin, okay, terazosin, alfuzosin. Now इसी में एक और वैरायटी आती है, ये बेसिकली रिड्यूस करते हैं ब्लड प्रेशर. अब इसी में एक और वैरायटी आती है which is actually called as tamsulosin, and this tamsulosin is actually alpha 1A selective blocker. ठीक है, so this is also called as scorpion sting. No, sorry, it is also called as uroselective. Now these alpha 1 blockers, these alpha 1 blockers are used in benign prostatic hypertrophy, and they're used in scorpion sting, right? Scorpion sting में भी बीटा alpha 1 blockers यूज किए जाते हैं. Tamsulosin specifically alpha 1A selective होता है, prostatic urethra पे act करता है, and because of that it is used in benign prostatic hypertrophy. It is more effective. Another drug here is silodosin. So this is also like tamsulosin. Okay, then next we have, इनका एक side effect होता है, that is that they inhibit the ejaculation. So that is one side effect of theirs. Okay, also they cause intraoperative floppy iris syndrome. in cataract surgery. Okay. Next we have alpha 2 blockers. Now alpha 2 blockers basically हमारे पास जो हैं वो हैं yohimbine and adesoxin. Okay. Now BPH में एक चीज़ और मैं यहाँ पे बताना भूल गई आपको. BPH में एक तो हम अल्फा 1 ब्लॉकर्स यूज़ करते हैं जो कि उसका डायनामिक कंपोनेंट ठीक करते हैं, और एक हम यूज़ करते हैं 5 अल्फा रिडक्टेज इनहिबिटर जिसका नाम है फिनेस्टेराइड, जो कि उसका स्टैटिक कंपोनेंट जो है वो ठीक करता है. ठीक है. सो नाउ कमिंग टू दी अल्फा ब्लॉकर्स, वी जस्ट हैव 2 ड्रग्स, योहिम्बीन, एडेसॉक्सिन. इन पे कोई ज़्यादा क्वेश्चंस नहीं आते हैं. मूविंग ऑन टू बीटा ब्लॉकर्स. नाउ बीटा ब्लॉकर्स में नॉन सेलेक्टिव होते हैं जो ड्रग्स, वो हैं प्रोपेनोलॉल, टिमोलॉल, पिंडोलॉल, नाडोलॉल, एल्प्रिनोलॉल, ऑक्सप्रिनोलॉल. Okay. Now these drugs, non-selective ones, they are used in classical angina, right? Because they reduce the oxygen demand, they reduce the cardiac workload. Then second, it is contraindicated in variant or vasospastic angina because it can result in vasospasm by itself. Contraindicated in asthma, diabetes mellitus and peripheral vascular disease. Diabetes mellitus में why it is contraindicated? Because it can result in dangerous hypoglycemia, right? Then contraindicated in AV block, right? Dangerous hypoglycemia में all the symptoms of sympathetic stimulation are masked except sweating. तो अब ध्यान आया वो स्वेटिंग वाला फैक्टर क्यों इंपॉर्टेंट है, क्योंकि सिर्फ स्वेटिंग इज मैनेज्ड बाय कोलिनर्जिक नर्व्स. ऑल अदर एक्टिविटीज ऑफ hypoglycemia like palpitations, anxiety, these are mediated by sympathetic system. Then we have cardioselective. Now cardioselective means that they are active on beta 1 receptor only, so they are safe in asthma, right, in peripheral vascular disease and in diabetes mellitus. Now इसमें esmolol is shortest acting and nadolol is longest acting, ये आपको याद रखना है. दूसरे कार्डियोसेलेक्टिव में जो ड्रग्स हैं वो है नेबिवोलोल, पिटक्सोलॉल, बिसोप्रोलॉल, सेलिप्रोलॉल, एस-ब्यूटेलॉल, एटेनोलॉल, एस्मोलॉल, मेटोप्रोलॉल, सेलिप्रोलॉल हो गया, एस्मोलॉल, एस-ब्यूटेलॉल. So these are the drugs which are cardioselective. They are safe. They are used in hypertension, angina, MI, arrhythmias, and CHF. Right? So cardioselective beta blockers are too much used nowadays. Then non-cardiac uses. Non-cardiac uses of beta blockers बहुत सारे होते हैं. सबसे पहला होता है एंग्जाइटी, जिसको वाइट कॉलर हाइपरटेंशन भी बोल सकते हो, एंड परफॉर्मेंस एंग्जाइटी, जैसे स्टेज पे आपको जाना है, वाइवा देना है, अगले दिन एग्जाम है. देन थायरोटॉक्सिकोसिस, right? Thyrotoxicosis. All these diseases, beta blockers are used by virtue of their being a anti-sympathetic agent, so it will reduce the sympathetic drive. Then glaucoma में we use timolol, right, to reduce the intraocular pressure. Then it is used in akathisia. Migraine prophylaxis में propranolol is used, and essential tremors में it is used, right? Now some important points about beta blockers. So beta blockers with intrinsic sympathomimetic activity, इसमें जो ड्रग्स आती हैं वो है सेलिप्रोलॉल, पिंडोलॉल, एल्प्रिनोलॉल and as-butalol. These are used in patients prone to develop bradycardia, okay, and they are less useful in angina because they are having a sympathetic activity of their own, and that can be harmful also for the patient. Plus patient who is having a tendency to develop bradycardia, there these drugs are going to be very effective, right? Then we have drugs, beta blockers with membrane stabilizing action, where we have propranolol, metoprolol, levetolol, pindolol, as-butalol. So these drugs, they have anti-arrhythmic action. They can be used in various type of arrhythmias, right? They have to be avoided in glaucoma, right? Then next category of drugs, we divide them as lipid insoluble. Lipid insoluble drugs are excreted by kidney, and they are contraindicated in renal failure. And in this we have drugs like nadolol, sotalol, atenolol, as-butalol, pitaxolol, bisoprolol, and celiprolol. Okay, so these are the drugs which are contraindicated in renal failure. As I've told you earlier, that nadolol is the longest acting and esmolol is the shortest acting. Another thing is that asbutalol has got all three characters. That is, it is intrinsic symptomatic activity bhi hai, membrane stabilizing activity bhi hai, and it is lipid insoluble also. Then we have third generation beta blockers. थर्ड जनरेशन बीटा ब्लॉकर्स. अब थर्ड जनरेशन बीटा ब्लॉकर्स में हमारे पास आते हैं लेबेटलॉल, कार्बेटलॉल. ओके, दीज ड्रग्स आर अल्फा बीटा 2 अल्फा ब्लॉकर्स होती हैं, राइट, बीटा 2 एगोनिस्ट होती हैं. दे ऑल्सो रिलीज NO, दे ऑल्सो ओपन पोटेशियम चैनल्स एंड दे ऑल्सो क्लोज कैल्शियम चैनल्स. सो दे हैव, what do they have? They have additional vasodilator action. Okay, this is their action. Now next, carvedilol is used in CHF. It has got antioxidant and anti-mitogenic properties. Okay, so carvedilol is used in CHF because of these particular benefits. Now let's come to the treatment of glaucoma. Glaucoma is said to be a disorder of eye where there is an increased intraocular pressure more than 21 millimeter mercury. Right, now how do you treat it? You either increase the outflow or you either decrease the secretion. So increase the outflow is done by beta blocker, alpha 2 agonist, and carbonic anhydrase inhibitors, and decrease secretion is this way. Decreased secretion is done by beta blockers, alpha 2 agonist, and carbonic anhydrase, and increased outflow is done by myotics, dapivirine, and prostaglandins. Right. Now, first thing, beta blockers are the first line therapy in primary open angle glaucoma, and the drugs which are used are timolol, pitaxolol, levobunolol, cartilol, out of which levobunolol is the longest acting also. Then second category of drugs is PG analogs, which is PGF2 alpha analogs. In this we have latanoprost and bimatoprost and unoprostone, right? Their adverse effects are, remember the adverse effects of PG analogs. First of all, they cause growth of eyelash, then they cause cystoid macular edema, and they also cause iris pigmentation. Okay, so these are the side effects of PG analogs. Then we have alpha 2 agonist, the third category of drugs, where we have dapivirine, apraclonidine, and brimonidine. Now here again, brimonidine is contraindicated in children because it causes respiratory depression, CNS depression, and apnea. Okay, so brimonidine का ये side effect है. Apraclonidine causes lid retraction of conjunctiva. Okay, dapivirine can cause black pigmentation. Sorry, it causes black pigmentation of conjunctiva and this lid retraction. Okay, then the other category of drugs is carbonic anhydrase inhibitors, in which we have acetazolamide, brimzolamide, and dorzolamide. My spellings are gone. Then we have myotics. Myotics में we have pilocarpine and physostigmine. Okay, now another paper. Pilocarpine can cause punctal stenosis of the lacrimal duct. This is the side effect of pilocarpine. Then ecothiopate is another drug, but it is rarely used now because it results in cataract. Okay, then there's a new drug. क्या नाम है उसका? Natar-Sudil. It is a new drug. It is a Rho kinase inhibitor. Okay, it can be used in open angle glaucoma with latanoprost. So this is a new drug, Natar-Sudil. Okay, then अगर पेशेंट को क्लोज्ड एंगल ग्लॉकोमा है तो उसमें व्हाट इज द ट्रीटमेंट? लेजर, पेरिफेरल आयरिडोटोमी. ओके, एंड इनिशियल मैनेजमेंट ऑफ acute angle closure glaucoma is acetazolamide. it will reduce the intraocular pressure. You can use myotics like pilocarpine, and you can use mannitol. Okay, so this is about glaucoma. Just 1 or 2 points here and there. Beta blocker poisoning में like overdose हो गया है ना, so the drug of choice to treat beta blocker poisoning is glucagon. Then Raynaud's phenomenon में what is the drug that we use? In Raynaud's phenomenon we use CCBs as the treatment of choice. I've told you cheese reaction में and clonidine withdrawal में we use phentylamine. And postural hypotension, yes, that is also important. Postural hypotension may you use fludrocortisone, which is a mineralocorticoid. So these were the important rapid revision notes of sympathetic system. So with this we complete the ANS.